Ambulance emergency, tell me exactly what's happened.
Emergency ambulance, what's the address of the emergency? Tell me exactly what's happened.
When the most serious emergencies strike, the ambulance has 8 minutes to respond.
I'm going to, sir, I'm going to tell you what to do, right?
With 999 calls doubling in London over the past 10 years.
I'm not asking if you're an atheist, I'm asking, do you want an ambulance?
In the control centre, every single one needs a split-second decision. Who needs an ambulance quickest?
It's so critical that we try and cut him down. It's the only way that we're going to be able to try and save his life.
And who must wait?
And I'm an ambulance, please.
Kathleen, the ambulance will not be coming to you tonight.
Kathleen.
Kathleen?
From the moment a call comes in.
It's been stabbed in the stomach.
Looking for any ambulance for a 16-year-old who's had her hand slashed by a machete.
Another stabbing?
Crews race to save lives.
Seconds feel like minutes, minutes feel like hours when you're waiting for an ambulance.
My name's Peter, all right? We're going to look after you. We're going to give some very, very strong pain medicines.
We've got a 94-year-old female who's fallen.
I need to know if he's breathing or not. It's really important.
He's as drunk as 1,000 people.
The NHS is under unprecedented pressure.
There was a hanging, there was a 4-year-old that's fallen 20 foot, and now we've got another double stabbing.
You're the Queen of England, so why have you dialed 999?
As London grows by over 100,000 people a year,
You've overdosed, fella. You've overdosed.
ambulances are struggling to keep up. The situation is now critical.
Someone's taken my Echo 231 for something else.
Another cardiac arrest, another deceased.
Please, God, be an ambulance. Be an ambulance.
This is the story behind the sirens. Through the eyes of the London Ambulance Service.
Did you see what you were shot with? A shotgun?
I think essentially we should say that she's gone. It's time to stop.
Sometimes it's just not easy. But you go on to your next job. Because there's somebody else that you can help.
Oh, London has woken up. Here we go.
Now listen carefully, I'm going to tell you how to do resuscitation. Okay, place the heel of your hand on the breastbone in the centre of the chest.
So if you're atheist, would I still love you? Frederick, that's not the point of the call. No, and I'm asking you a question, Frederick. Do you need an ambulance?
Shouting is not going to help this situation. Please tell everyone to calm down. This is very important. We need to help her.
It's Friday night and the start of a long weekend in the control centre for A-Watch.
I do need to advise you that the 999 lines are very busy.
Just tell them to be still and wait for the help to arrive, OK?
Of the 2,500 calls for help they expect to hear tonight, they know the number fueled by drugs and alcohol will be double the normal rate.
Tell me exactly what's happened.
I believe it's a drug overdose.
Is he awake?
He's awake, but he's thrashing out.
Is he breathing normally?
No, very erratic.
Overdose.
OD on cocaine and MDMA.
Red wine, oh no. Okay, let's go.
The overdose call is in Brixton. South London-based crew Dan and Donna are immediately dispatched.
If it's a weekend and it's a payday and it's full moon, then you can be guaranteed to see absolute carnage, drunk, drug-fueled problems. But that can be quite interesting, and I do quite enjoy that, to be honest.
Dan and Donna are a mile away from the patient. With reports that his condition is worsening, an advanced paramedic who's specially trained to deal with overdoses is also sent.
Red Base Alpha, Papa 6-1. ETA is going to be about 5 minutes on this call.
ETA is 5 minutes, thanks Richard.
He's reported to have a very fast pulse and actually be quite hot as well. And both of those conditions can cause problems with kidney damage, muscle breakdown, and can actually make you quite unwell.
Rich is on scene in 6 minutes. Dan and Donna arrived in 4 minutes.
Are they coming out now?
Yeah, they're coming out.
Okay. What do you know?
21-year-old, he was shaking quite a lot when he got first in.
Yeah.
Possibly a small fit.
Fine.
We've packed him with some ice for now.
Yep.
We brought his temperature down to 40.3.
You're on the back of an ambulance, buddy. You're okay, but we just need you on the bed.
Okay, look at me, okay? Nothing's going to happen to you, okay? We're trying to help you.
Relax, just relax. You're all right.
Okay?
You're all right.
Don't phone my mum.
We're not your mum.
I'm not your mum. I'm
We're
trying
the
to help you,
ambulance crew.
okay?
You're in an ambulance. Just peel it that way.
Just relax. Take your hand off me, please.
Let go of him.
All right.
Okay.
Let go. Let go of my shirt.
You're going to get a little scratch, buddy. Right, it can take a little while to work. Right, relax.
Calm down, okay?
All right.
We're just trying to help you.
Good man.
All right?
All right.
The clubs are beginning to close, but the Friday night party is still in full swing.
She can't even walk.
She can't walk.
Yeah, she's like, she's very, very drunk.
So I've got a very good friend of mine. We went out for a few drinks tonight, and I'm a little bit concerned that maybe her drink was spiced.
What's your name? Do you know what your name is? Yeah, he's not making any sense.
First response paramedic Andy is on his way to a call outside a kebab shop in East London.
So we've just been dispatched to a young lad who has got facial injuries after being robbed. Hello, mate. What's your name, fella?
Ali.
Ali. My name's Andy.
Mate, I went to get a doner kebab and I got donnered.
Oh, no.
I got donnered. Oh, shit, man.
Do you live around here?
No, I live in Essex. I come especially for that
You
doner,
came
man.
all the way here for a kebab?
For a kebab and I got kebabbed.
Can I just have a little feel of your head? Is that all right?
Yeah.
Yeah?
Oh, that's all
That's
swollen.
it, yeah. Ali, it's going to be a trip to hospital this morning. Yeah. All right.
Andy operates alone as a first response paramedic. 24-year-old Ali's condition needs to be closely monitored, and this requires an ambulance.
Thank you. Could I arrange some transport for this gentleman to hospital, please, over? Open your mouth for me. Have you broken your nose before?
What?
Have you broken your nose before?
I think so, man. But I don't really like it that way.
All right.
I can box it in, so...
You had a bit of a wonky nose to begin with?
Yeah.
Yeah? What actually happened?
They went, yo. At the moment they said, yo, I just knew what it is, and I turned around. They go, what you got for us? The guy come running, he just backed me so hard. My phone fell out, my car keys fell out, my glasses come off of me, and my watch, and I was fighting, the watch come off, everything come off. Yeah, I'm surprised my boxing didn't come off.
Truck's just around the corner, dude. All right?
Yeah.
And we'll get you sorted.
Hope to find my watch.
Oh, yeah. What watch is it?
Rolex.
Oh, mate. How much is that?
Long time.
What do you do for a living?
I'm a wholesaler and retailer in ladies' fashion.
All right.
I've been busy loads, excellent claims, and now I'm opening up a shisha lounge.
So you're a little entrepreneur?
Yeah, man.
Yeah? See you on Dragon's Den in a few
Yeah.
years, like piles of cash in
I
front
love
of you.
old Dragon's Den, man. You get me?
I think transport has arrived, Ali.
I must be back in the hospital, yeah?
All right, Ali, I'm going to leave you in these guys'
That's
capable
all right.
hands, mate.
Thank you,
All the best, all right? Look after yourself. Cheers, guys.
How you feeling there, Ali?
So good. I never felt this good in my life.
Last year, the London Ambulance Service treated over 31,000 victims of violence, and at the weekends, casualties rose by 50%.
I think we have a distorted view of London. We see the violence and we see the result of it, but I don't think London is more or less dangerous than any other part of the country. It's just, as an ambulance service, we know about it and we hear about it and we see it.
Can we put a little bit of oxygen on your face, just a little mask, just to help? Yeah?
In Brixton, the MDMA overdose patient has been successfully sedated, but he still risks overheating, so they must take him to hospital for further observation.
Red base, Alpha.
Alpha 6-1. You do a phone call to King's College when you're ready, please.
Yeah, go ahead, mate.
So we've got a 20-year-old male. He has a pulse of 160. He has a temperature of 0.2. ETA is only about 5 minutes, Rog.
Yeah, Rog, that's all being done for you now.
You're in the back of an ambulance, yeah? We're going to take you up to the hospital and we've let them know you're coming, all right? Because you're very hot, your heart's going very quick, and you're having a reaction to the drugs.
He took a disliking to me for some reason. He's very, very paranoid. I think he thinks that we're his mother, which isn't ideal.
You're not in trouble, you're fine, OK? But you need to relax and trust us, yeah? Can you do that for me? Good man, good man.
ETA, 10 seconds.
Thank you. You're calming down a bit now, aren't you? Yeah, that's good. You'll feel a bit better in a minute.
You take drugs at your own risk. You can't stop someone wanting to do that. We will always be there if someone does overdose or take something the wrong way and it all goes horribly wrong. But it shouldn't get to a point where it impacts on other people's health because you overdose and then need an ambulance. Oh, a bit of ADD.
When we erupt into the room, I hear the sound go boom.
I look at my friends sometimes and what they get up to, and they're still out every week getting pissed, and I'm on a Friday night, you know, in an ambulance going to them and people my age, and that can be a bit surreal sometimes.
You like this song, don't you, Donna? Come on.
I've never heard this song before.
It's Katie B. How have you not heard this song before?
So this job has definitely made me more mature.
I might play my Joker card, Donna.
As the shift draws on, the aftermath of Friday night partying shows little sign of letting up. There are 19 crews currently treating drink and drug casualties. But not all calls are the result of tonight's partying.
Are you having contractions?
A lot.
Okay, is this your first delivery?
Not hurt.
Okay.
Can you have a look at her vagina and tell me if you can see any part of the baby?
No, not really, but she's at water broke.
Just reassure her that help is being arranged. Keep her lying down. We're coming as quickly as we can.
I know that she's screaming, I know she's in pain, okay, but she needs to try and stay calm, all right, and take deep breaths in.
At this moment, there are 3 women in labour currently on the line, and ambulances have been dispatched.
Okay, I'm going to tell you how to deliver the baby just in case, okay? Raise your head up with pillows, but don't sit up, and do not go to the toilet.
Call handlers are trained to deliver babies over the phone, in cases where it's clear the baby won't wait.
Listen to me. Right, can you go on? Right, is the whole head is out, you're saying?
Sorry?
Is the whole head out?
Yeah, the head's out, yeah.
Right, listen to me. Push hard now to get the baby out, please. Right, as the baby delivers, it's going to be very slippery, okay? So just be careful and support the baby's head and shoulders.
Yeah, the baby's out,
Right, the whole baby out? Is the baby crying or breathing?
Yeah, the whole baby's out, yeah.
Right, okay, sir, is the baby crying or breathing? Yes?
Yeah.
All right?
Yeah.
Okay, congratulations. Is it a girl or boy?
I don't know. I don't know.
You don't know?
I'm in a shock.
You're in shock? Well, welcome. The ambulance should be pulling up outside now.
Okay.
Okay, congratulations. I'll leave you with them. All right. Thank you. Bye.
Is that the ambulance crew with you? Okay, I'll leave you with the ambulance crew. Thank you.
I'm going to leave you with them, okay? Good luck. Lots of babies tonight.
A call has just come in from the police in East London for a man who's been reported unconscious. First responder Andy is sent.
Hi, mate. He's just got up.
Oh, is he?
We've been here for an hour, laying there, shivering. He's got very cold. The sun's turned up. He's not been taking his mental health medication.
Oh, okay. My name's Andy. What's happened tonight?
Nothing.
Nothing? How come you're outside?
No, I don't know.
You don't know?
I don't know.
Okay. It's very cold.
I feel hot.
Do you feel cold?
Very hot.
Very hot?
Very hot.
Okay.
Very hot.
How long have you been feeling hot for?
Hot. 1985.
Sorry?
Since 1985.
Since 1985?
1985.
What year are we in?
I don't know.
You don't know? Okay. How old are you?
I don't know.
All right. Can I do a couple of checks on you?
No.
No? Why
No,
not?
don't touch me. Don't touch me.
Can I check your blood sugar?
No.
No?
No.
Does he have any medical problems?
Yeah, he's a mental health patient.
Okay. Does he have any other medical problems?
Bipolar.
Okay. Unfortunately, I'm very limited in what I can do right now. I think, as you probably know anyway, the best course of action, we're going to pop him back down to the hospital, I think.
I think that's what he needs.
Yeah. Just a little update for you on this very, very much a mental health job. She's going to need to go to hospital, so we are going to need a vehicle at some point.
There are currently no available ambulances in this area. Andy's mental health patient must wait, but he's starting to get restless.
You have to stay, I'm afraid.
We try to keep you warm. I went to jail.
Nobody's looking at putting to put.
200 miles.
Nobody's looking to make you go.
200 miles, they go to jail.
Yeah, what we're trying to do is get you somewhere safe and somewhere warm.
Then leave it.
If the patient continues behaving erratically, he risks being detained by the police to prevent him harming himself or anyone else.
Somebody's getting nervous. I'd rather not have him left. Yeah? They're not leaving in there, it's 5 o'clock. Excuse me, please.
Finally, a private ambulance arrives, one of 18 that have been specially contracted tonight to ensure they can safely cover the whole of London.
Hello guys. I think the police are going to do most of the work. I think the more people around him, the more difficult it's going to be to manage.
Over the last year, there's been a 15% increase in the number of mental health calls the London Ambulance Service attends.
It's desperately sad when people are in that situation, and we try our best to help them as much as we can, but really, the only choice we have is to take them to hospital, which isn't right, it isn't where they should be. A&E is not a suitable place for people who are having an acute mental health crisis, but it's the only avenue open to us at 3 o'clock on a Saturday morning. Something's missing with our mental health care at the moment, and I don't know what the answer is, but what we're doing at the moment isn't working. We'll put a plaster on it tonight, and then next week it'll be the same story again.
Hello, what's happening there?
No, nothing. He's not unconscious, he's just drunk.
Why do you need an ambulance? He's drunk.
We've had a gentleman here, he's passed out in the toilet.
Yeah.
He has shit himself.
It's probably a very good reason why that they didn't prescribe dog worming tablets to you as a human being as a type of medication.
Pete is in charge of the team dispatching ambulances across West London this weekend.
He read on Google that these dog worming tablets contain an active ingredient that helps people with anxiety issues. Asked the doctor to prescribe them. The doctor said no, so he went online and bought them online, and he's been chewing them for most of the day.
Is he still anxious?
Well, he's not so much anxious as petrified now that he's done something to hurt himself because of eating his tablets all day.
So his anxiety's gone through the roof now?
So he's gone through the roof.
Oh my God.
I'll tell you, if you wrote a book, they would put it in the fiction section because they'd never believe that this stuff happened for real. OK, and is she breathing? She is.
Back in the control centre, the Saturday night shift is getting busier.
At the moment, we don't have enough resources available. She was in the bath. OK, has she had a... listen, has she had a fit? And there are some very, very difficult decisions to be made by the allocators. Which ones do I hold? Which ones do I send? We've got some help on the way to you. OK, they're going to be with you really, really soon. Sometimes you feel like you're playing God. You have to make that decision. Split second. Send, don't send. It's hard.
2 hours in, and there's a queue of 53 patients who've been assessed and are now waiting for an ambulance. And more calls are coming in.
We just had a big collision.
How many people are injured?
2 people.
Are there any obvious injuries?
Yes.
I'm gonna go and jump off Emma Smith Bridge, I think, because I've had enough.
You'll have to tell me exactly what's happened?
I have a 6-year-old daughter who's fallen on her head from the bunk bed, and her forehead is swollen, severely swollen.
Okay, so that help has been organised for you.
we are on our way to a young child, a girl, female, 6 years old, and she's fallen from a bunk bed. Head injury, it says.
West London-based crew Ned and Nick are on their second call of the night. There are now no more ambulances available in this area, and within a minute, a further 4 new calls come in.
Can you tell me exactly what has happened?
I've been punched in the face. My son's been stabbed in the leg. He's losing a lot of blood.
Jace, you seen this 4281? Yeah, thank you. Reports coming in of a patient that's been stabbed in the leg, losing a lot of blood.
Within a mile of the stabbing, there are 3 ambulance crews, but all are busy. Ned and Nick are on their way to the 6-year-old who's fallen from her bunk bed. This is a lower category call, so they are diverted to the stabbing.
Cancelled.
One part of the job that's not always easy to do is juggling.
So we're going to a stabbing now.
6.2 miles.
You know, you've got 1 ambulance, 2 patients, both nasty ways of injuring yourself, and we've got to make the decision who gets and who waits. You know, I'm a dad of a 6-year-old girl, so if that's my 6-year-old girl that's fallen off the bunk bed and is waiting for an ambulance, I don't care who else is hurt. It's my little girl. I want her to get the ambulance. Hopefully that little girl's not too badly hurt, but, you know, if they're stabbed in the leg and there's a lot of blood loss, that's going to kill them fairly quickly, so...
There's another ambulance on the way to that came up green.
To the kid. Brilliant. Lovely.
It's in here somewhere, isn't it?
I get worried sometimes going to these jobs because the assailant is probably still around on scene and it's your job, you know, to attend the patient, but also watch your back and your crewmates. And then it should be your first left. There have been a few occasions where I know that I've gone in on my own to go and help a patient, full well knowing that there's someone there that could probably cause me harm. So it is scary, very, very scary sometimes.
Hold back until police are on scene before making progress over.
Yeah, all received now. Oh, no, yeah, no, it's the police. Do you guys have a bit of a story of what's gone on at all?
Unfortunately, not at the moment, no. Our colleague is upstairs doing.
Okay.
With him.
Okay. Oh, okay.
Is he inside?
Apparently so. They're all upstairs.
The attacker has fled, leaving the victim bleeding on his mother's doorstep.
He doesn't look very well, does he?
Mate, so he's got about 2.5 centimetre wound, maybe 3 centimetre wounds to his thigh. He's got pulse around.
Okay, mate, please, if that's all right. I don't think you're very well at the moment because your pulse is kind of... Should we get you in this chair? We'll take you down to the ambulance and then we'll get you sorted out. So just hold on for a minute.
Yeah, 1, 2, 3.
How long ago did it happen? An hour ago. And has it been bleeding all that time?
Yeah.
Has it? Stabbing someone in the wrong place will definitely kill them. In my life, it's so unfathomable that someone could do that to another person. But it happens often. And I have to question whether these people understand the consequences of their actions. My name's Ned, by the way. All right, mate. Nice to meet you too. I just need to put a really small needle in your arm.
So we can give you something for the pain as well.
Oh, just stay nice and still for me, mate. A quick scratch coming up. I grew up in like a tiny, tiny village in West Dorset. The worst thing you'd ever come across down there is that, you know, a neighbour's had a fight, someone's been kicked by a cow, someone's fallen into a slurry pit. So the idea of going to a stabbing where someone's actually been stabbed by someone is completely removed from my normal life. But now it's part of my everyday life, it seems.
That's okay.
Foxtrot 230, can you show us blue to St Mary's, please, as a major trauma?
He is saying that it happened an hour ago from before we arrived. So I think that could be potentially quite dangerous if, you know, he's been bleeding all that time.
If you imagine pint glasses, right? All the blood that's been trickling out over the last sort of couple of hours, how many pint glasses do you reckon it would have filled up? Just a rough guess. So you reckon it's possible that it might have filled up about 5 pint glasses, you reckon? Okay, well, I'll listen to you.
Just going up the ramp now, guys.
In London, 800 crimes are committed with knives every month, injuring over 300 people.
Becoming more common, and certain elements of society have this habit of stabbing people in the backside, which it's not so much to do with the injuries that it brings out, the stabbing, but the victim will end up having to wear a colostomy bag for the rest of their life. Is it what they call bagging, isn't it, Michelle? Sometimes called bagging. They bagged someone. It's not nice. Not nice at all.
In the first half of tonight's shift, the ambulance service deals with 44 assaults across London. They must balance coping with these alongside every other emergency that comes in.
I'm in terrible pain. Every time I'm over, I feel like I'm going to pass out.
All right, Donna. Just to advise you, there might be a delay because we're holding calls at the moment.
I'm waiting in the cold and I'm not used to this weather. It's fucking cold in here. I'm dying.
Right, so is there anything actually wrong with you that you require an emergency ambulance?
Yes, I'm cold. I'm going to die. I'm really cold. I'm shaking.
Tell me exactly what's happened.
She just falls down and dropped down on the floor. And I can't lift her because I got backpack.
Right, okay.
An ambulance has been requested in southwest London. Dan and Donna are sent to help.
How have you ended up on the floor today, Margaret?
I went out to go on the toilet.
Yeah.
I didn't reach the toilet. I reached the door here.
Okay.
I think I had some kind of fit or something.
What makes you think that, Margaret?
I was just totally out.
Okay. Okay. How much have you had to drink today?
Not a lot.
Not a lot?
No.
Okay. All right, let's sit you up and get you on the bed then, okay?
Your hands again, Margaret.
3. Well done. Stand up, Margaret. Well done. Okay? Okay. Have you had this pain in your side before?
No.
No? So if you had to give it a number out of 10, if 10 was really bad and 0 was no
I'd say
pain,
about 9.
a 9. So really like crippling. Okay.
I'm going to get your tissue. Your nose is funny.
There?
It's like, ah!
Well, I'm pressing there.
It's like,
Your
no,
rib.
here. Where
Here.
I'm pressing, yeah.
There. See, if it's causing you that much pain, we should really pop you up to hospital, really. Come on, then.
The London Ambulance Service receives nearly 100 alcohol-related call-outs every shift. On a Saturday night, that number doubles.
Margaret, do you drink half a bottle of vodka every day? No? So is it just...
I recently come out of rehab.
Okay.
And basically, I drink about twice a week.
A lot of the stuff we do is routine, mundane stuff, and you think, why are we doing this again? Why are we going to this person who's fallen over? But what's the alternative? We can't just turn around and tell people who've been drinking they can't have an ambulance, partly because we'd be out of jobs, there'd only be about 4 of us sitting here every weekend, but also partly because people who do drink become vulnerable.
I like you because you're helping me.
Well, of course. It's why I'm in this job, to help people, Margaret. OK, let's play another game. How old do you think I look?
Show me your teeth.
Is that an important part?
Yeah.
How about my teeth, then?
What about Donna? How old do you think Donna, our Care Bear in the front, is?
25. 23.
Oh, bang on for me. And
You
pretty,
took 8...
pretty close to Donna as well.
Yeah, you took a few years off my life.
Just a decade.
Well, there you go, you know.
Dan!
When I put me glad rags on and I got my face
I bet you look lovely.
I don't look 50 odd.
I bet you do.
Oh, shit, yeah.
So we'll go this way.
Halfway through the Saturday night shift, and the control centre is taking calls at a rate of 250 an hour.
There's been reports of a fight Leicester Square, Burger King. A male with lots of blood. Head was hit on the floor, apparently.
She has, in 3 gulps, next a bottle of vodka before she came into our premises. The owner of the pub has his head, he got punched.
Right, so he's been assaulted?
Yes.
And was there any weapons involved, Option?
A lady went to glass him with hit him with a glass.
Okay. And is he awake?
No, he's not. Well, everyone, shut up so I can hear what he's saying on the phone.
Ambulance crews are currently dealing with 9 people who've been assaulted, including 2 stabbings.
So we've had stabbed in the leg,
Yeah.
We've had a bottled or slashed across the face, stabbed in the back.
Yeah.
Tonight it's been a bit of a stab-a-thon.
Yeah, there's another one just come in now, actually. Where's that one?
Hello, can I get ambulance please? Someone's been stabbed.
The address of the emergency?
Soho, someone's been stabbed.
A first response paramedic is already on scene, and an air ambulance team has been dispatched, but they'll need backup. Half a mile away, ambulance crew Ned and Nick have just become available.
Another stabbing?
Got another stabbing.
Is there any serious bleeding?
Yes, a lot.
It's a central stab wounds in Soho.
Is the attacker still nearby?
Oh, chill out.
Listen, please listen to the questions I'm asking you. Is the attacker still nearby?
Still there, they're
still there.
Yeah.
I don't even know if I fit in mine. I think I'm probably too fat to get in my stab vest now.
It's a 4-minute journey to the crime scene. The police have moved in to cordon it off.
Yeah, he's down there. He's stabbed in the back. I've been dealing with.
The patient has already had his wound dressed by Stuart, the first paramedic on scene.
Lower back, yeah. Okay. I don't know how deep it's gone. I don't know what was used. It was a female.
It's a knife.
I'm going to peel it back, and it was a knife. Yeah. And let them see it. Okay.
There is a fairly significant amount of blood. Ned. Yeah.
So is this the only one?
That's the only wound that I found. Yeah,
Oh,
that's
nice
it.
one.
So it's already been packaged up by the paramedic I've seen previously.
Sorry for that, sorry.
But I'd say there's got to be more than 500 mil in his trousers at the moment. In fact, every time he sits down, there's more and more and more.
And that's just come down from there.
Appears to have just dribbled down. Yeah.
It was all quite manic when we got here. Like, I'd literally got...
I got sucked right into this. I was on another call.
Oh, really?
Yeah. I said, come to the car and tried to dress his wound. I had to get the police to help me put the dressing on because he wouldn't sit still. He was pushing at me and shouting. Not worth my life, this job. I've been doing this job for 13 years, down West End. And it's just the worst for stabbing now.
Well, this is our second one in a row. The job before this was a stabbing.
I wish people would just punch each other out. Why did they have to use knives? It's just crazy.
The patient's injury is potentially critical, so he's taken to a major trauma unit on blue lights. He's the 5th stab victim of the night.
I can remember though when, if you got a call for a stabbing, it was a performance.
Yeah.
Now, if we do a shift and we haven't had one, it's a comment of note.
Right, so I am holding 1, 2, 3, 4, 5 category A calls, all we needing ambulances.
Going to have to take Alpha 230 off that hot 2 to go on the Hayes.
Calls are still coming in at over 200 an hour, and in the west of London, there are currently no ambulances available to deal with them.
I am dragging Charlie 450 from the other side of London to try and help this really poorly man. And I'm also holding an uncovered category A call, and there's no one anywhere who can help.
That's it.
It's busy in Dan and Donna's area too, but they can't help clear the backlog because they're tied up with a patient who's homeless and has discharged himself from hospital.
We can't take this out here. We've got to take you up to the hospital to have that done, okay? I can't do that in this ambulance with you today.
His cannula needs to be removed.
Definitely doesn't want to go back to Mayday. That's fine, we'll go to George's.
Do you drink alcohol, Wayne?
Yes.
You had any alcohol today?
Well, no, not really.
No?
I had the money.
Gimbal Castle, Mobile to PDO 2, currently holding an uncovered category call in Uxbridge, also holding category calls in Hayes, Heathrow, West Drayton, and another one in Hayes.
If we literally have nothing available at all, no cars, no ambulances, no motorbikes, no volunteer responders, we'll just put out a general broadcast, anybody available please to assist with an emergency call and hope that, sometimes pray, that somebody offers up.
General broadcast, all mobiles, talk routes 3 and 4, currently holding a category A call.
General broadcast at 29 Lima.
What's this you're drinking?
Coca-Cola.
That's not Coca-Cola, that's something else. You've diluted that with something. What's in there? You can't be having a party on the ambulance drinking...
I'm not, it's orange juice in there.
Okay.
If I was...
Right, are you ready to go? We're going to head off to the hospital.
Yeah.
just because he's pleasant and nice with being drunk and whatever, there is a fine line between that and actually taken away from the jobs we should be going to. He needs to get his cannula removed. That needs to be done in hospital, really, but it doesn't need an emergency ambulance. And while we were on scene there were 2 general broadcasts over the radio. So you do then think sometimes, as nice as it is to sit with him chatting, actually, there are sick people out there that need us more than him.
Without any hospital, I'm going to say to them, I want a sandwich. I've got to have a sandwich to eat, otherwise I'll die.
Right, step this way.
That's it.
Well done.
That's it. That's it. This way.
I think the government's out of order at the moment. They've cut back on the ambulance crew, and they've cut back on the police force. Now, don't get me wrong, I'm not a big lover of the police force, but they're a necessary evil. And we need them. We do need them.
This chap here is going to assess you, and then he'll come and sort out taking this out for you and getting something to eat for you, okay?
I'm not saying it now.
I'm going to go and look now to find out what they've got, okay?
Do you have any sandwiches for patients?
There's not been anything since like 8:30.
No?
Bread and jam.
Yeah? They have no sandwiches, but they've got bread and jam. Would that be okay? No? We don't like bread and jam? He doesn't want bread and jam, but he's quite content now. I think he's sleeping. He could have been delivered here by other means, maybe, but he needs the cannula removed, and it's a place of safety for him, so we've done the best we can. He's here, and if he's hungry and they can offer him some food, then what's a sandwich? It's nice, isn't it? It's just nice to be able to help do something at least. I can't offer him somewhere to live or change his life, but a sandwich is a sandwich.
That guy's taken the piss well and truly. So he's refused to let them take out his cannula because he knows, he's not an idiot, that he'll get found, he'll have to go to hospital to get his cannula taken out. So we've now taken him to St George's at a cost of £450 thereabouts to taxpayer. So that's a very expensive sandwich, isn't it?
He didn't get a sandwich.
Well, whatever. But I don't necessarily...
Yeah, I'm not saying it's right, I'm just saying I understand.
So why do you feel sorry for him then?
Because I do. He's homeless, he's hungry, and he feels that's his only way to get himself something to eat. I'm going to go take the crutch back.
Well, when you tell you what, when you go take that crutch back, why don't you give him a big hug and a pat on the back and tell him well done, and give him the receipt or actually an invoice for the cost to us when we could have gone to that 19-year-old having a fit or the 20-year-old unconscious. You're not upset with me, are you? I still disagree with you, and I think you shouldn't feel sorry for him. You should feel sorry for the people that we've let down, that we haven't been able to get to, because we've been tied up with Mr. I want a sandwich. Do you feel sorry for them?
I didn't say that what he did was right, or that he should be treated over anybody else. I just said I understand.
And you feel sorry for him?
I feel sorry for his circumstance.
Okay. Circumstances aren't pleasant, are they? But, you know, it could be worse.
It could be a whole lot worse, yes.
What is a whole lot worse? Tell me.
Working with you for a night shift.
That's not funny.
It's Sunday night, the final shift of the weekend.
My neighbour's just come down and her finger's completely trapped in a toaster and it's all pretty horrible.
She's got a finger trapped in a toaster?
In a toaster, yeah.
Is that the toaster one? I'll leave off. I mean, how do you even get your finger trapped in a toaster? She must have giant hands.
Do you know why you got feelings in your heart?
It's like a game of roulette. You know there'll be all these jobs waiting for you, and it's just luck of the draw to which one you're going to get. After a run of mundane jobs, it's nice when you push that button and you get someone that does seriously need an ambulance.
The streets are ours. Tonight, the streets are ours. These lights in our streets are ours.
Do you need assistance? Do you need assistance? Do you need assistance?
You'll be sprayed by sea spray. It takes about 15 minutes to wear off. All right, it's going to cause your nose to run.
Right, come out of the way.
Dan and Donna have been sent to treat a taxi driver who has been involved in a fracas.
The quick story is, guys, that...
Was he knocked out? Was he?
No. So what's happened is he's assaulted the taxi driver. Can we'll leave it with you? I've requested police for you because he's getting a bit...
Yeah, sure.
But, yeah.
Think that might just need some glue on there or maybe a stitch, all right? Sorry?
Terry would rather drive himself up to hospital, which I said is fine.
Are you sure?
You know,
Okay,
his numbers are getting better.
Okay.
Because he's got all his stuff in his cab and doesn't really want to...
Leave it, okay.
Yeah. Oh.
That was a bit chaotic, wasn't it?
I know, but that is what I love about this job. When you get on scene, it's just all chaos is broken loose, isn't it? You never know what you're going to be faced with.
No.
And that's exactly that. And I love it.
He is the reason.
Absolutely love it.
Okay, no, okay, I know you fought with the Germans, okay, I'm not disputing that. Okay, I don't think some of these people are Germans, sir, okay? So what I'm asking you, sir, is what is exactly wrong that you need an ambulance?
In the control centre, a call is in progress from an elderly patient who lives alone.
No, sir, you can't wait until they come because you haven't told me what...
He's already been visited once by an ambulance tonight. The crew decided he didn't need a trip to hospital.
Hello, sir, this is London Ambulance Service. You can't just hang the phone up, okay? Okay, you're saying you need some help, so I need to know what is wrong with you to send you the help. Okay, your heart is hurting. Thank you very much. Okay. Okay, could I confirm your address once more? He's just hung up again. Why does he keep hanging up?
Because the man claims he's experiencing heart pain, an ambulance is dispatched. Dan and Donna leave the scene of the taxi driver assault in central London to attend.
Okay, so the help is on its way to you now, sir, all right? Okay, thank you very much.
You're not going to die. All right? You just need to take your tablets in the morning in 3 hours' time. Why do you call ambulances? Because you call us a lot, don't you?
I call a lot because I have pain. I got pain in my heart.
Okay.
You were here before, about half an hour ago.
We weren't here half an hour ago. You had a different crew here before, didn't you? Another ambulance crew, yeah.
Oh.
At 7 o'clock this evening, they were here to see you, weren't they?
Oh,
So you was in hospital yesterday. Was it an ambulance that took you there?
yeah.
Yeah. Okay, I've got to pop these ones across your chest, okay?
Just looking through this gentleman's patient care plan we've got here, he is a frequent caller to us with chest pain, non-traumatic chest pain,
I put those away for
and medication queries or catheter problems. He used to be an artist. So that's a self-portrait of him, yeah.
It's lovely, isn't it?
The patient is visited by a carer 3 times a day.
Can I just have a listen to your chest? Is that okay? Have you had a cough recently at all?
Yeah.
You have? Just one more thing I want to do, if that's okay. Just say 99. Say 99.
99.
Just clear your throat. Just go like that.
Yeah.
Say 99.
Oh, yeah.
Okay. We've checked you over. And from what you've told me and the way you've described things, okay, I'm not worried that it's your heart.
It is my heart. It is from my heart that you are leaving me alone. I can die and you know what.
But we can't sit here with you all night, can we? You see enough of us, you shouldn't worry too much.
I wanted to take me to hospital back.
Why did you want to go to hospital?
To be sure that I will be alright when I take my medicine.
But I'm telling you, it's not your heart.
It is my heart.
I think we'll have to agree to disagree on that, won't we? If there was anything wrong, we wouldn't be discharging you here. We'd be taking you to hospital. Everything's fine. Try not to worry, all right? If we go, are you going to call another ambulance?
But you are leaving me here. Oh my God.
Yeah?
I don't know what to do.
His situation is sad. Bye-bye. He's got no friends, he's got no family, he lives on his own. There should be another system in place that he can call for when he gets anxious.
What system's that?
There isn't, and that's the problem.
London's very demanding. It's a demanding place to work. 11 o'clock on a Sunday night, you're not getting hold of social services, you're not getting hold of the ongoing care teams. These people that have got ongoing medical problems can't contact their social workers, they can't contact Meals on Wheels, they can't get hold of district nurses, and that's where we, the NHS, is failing. When I started 15 years ago, I thought I was coming here to make a difference, to save lives and, you know, deliver babies and do CPR over the telephone. The reality, unfortunately, sometimes is starkly different. But then every so often, something will come in, a call will come in, and you'll end up thinking to yourself, yes, this is it, this is what we came here to do. This is why I do what I do.
Right, tell me exactly what's happened.
Basically, my wife, she's pregnant and now she's too much in contraction pain and bleeding.
She's bleeding?
Yes,
And how many weeks or months pregnant is she?
21.
21 weeks?
Yes.
Roger, you'll receive premature 21 weeks and crowning. Thanks. I'll get there as soon as I can. Thank you.
A crew is already attending what could be a premature birth, and they've requested extra support from advanced paramedic Rich.
550, good evening, this is the APP desk here. Just to let you know, AP61 is 10 minutes away.
Initially with this, I just need to be really calm. Mum will pick up on any anxieties or any worries I have, and obviously I am going to be concerned about her. I'm concerned about the baby as well. But Mum has to be confident that we can help her, that she's safe with us. So overall, it would just be very calm.
First response paramedic Kelly has been treating the patient before Rich arrives.
Yeah. This is her fourth pregnancy. When I got to her, she was in quite a lot of discomfort. I had her on Entonox, and all of a sudden, waters broke.
Right,
As well as blood, and I could see baby's head.
Right, OK.
But since the waters have broken, she is in no pain.
Yeah, I think let's just go now.
Yeah.
And then we'll do everything else. What's the ETA to Queen's?
About 10 to 12 minutes.
Right, a little scratch. Can you just let him know I'm going to cannulate, just after slow down a little bit. Warn me if there's a corner.
Down a bit.
It's fine, just done it.
Done.
Thank you. So there's a little bit of bleeding, not sure yet what's going on. It might be an early labour, might be something else. What we can't do in the back of here is monitor the baby, because we don't have the equipment, it's specialist. So obviously I want to get you up to the hospital as quick as possible. The maternity unit have been pre-alerted, so they know we're coming in. Potentially difficult case for them, so we've made them aware. So from what I read my colleague, large amount of amniotic fluid or water, PV bleeding, and what looked like crowning. All right? Good luck.
All the best.
Take care.
Okay? All the best. You'll be fine.
The mother's condition stabilises over the next hour, but doctors find major complications with a tumour in the placenta. Her baby cannot be saved.
Cheers, mate. Pete? It's not a good outcome. No. So babies die.
No one turns up for their day at work wanting the outcome to be the worst outcome for the patient. You're always fighting for the best outcome. And when it doesn't happen, despite your best efforts, that's deflating. It does happen, it's part of the job. And it takes a little bit of time to process that and then to move on with the rest of the shift. And we've all got to go back to work, despite what happens.
The APP said they're OK, but people say they're OK when they're not.
As I left her, her parting words to me were, well, thank you, and I hope my baby lives. And then to be told by the nurse that it hasn't, what I'm going through pales into comparison to what they're going through. I can't even imagine what they're going through. But you kind of brush yourself off and come in again the next day or go on to your next job because there's somebody else that you can help. And that helps just spur you on. But sometimes it's just not easy. It's not easy.
I'm going to pop out because my twins were 21 weeks and it's actually hit me a little bit. My wife and I lost twins at 21 weeks last year. Our son and our daughter, Lily and Max. Yeah, it's upsetting. You don't let a lot get to you doing this job because you can't, but there will be maybe one a week that does stick with you and that you do think about. Sometimes it makes you realise why you do the job, but then other times it makes you just want to go home and give your loved ones a cuddle and just sort of remind yourself that there's things away from the job, more important things.
Salt beef bagel from Brick Lane. Just what's needed at 5 o'clock in the morning. That's amazing.
Steal yourself, pay your bills. I just want the way I feel.
It's gonna be a nice day, I think.
Nice day, in bed.
What size bed? Have you got a double bed or have you got a super king size bed, like me?
What do you keep going on about this king size bed?
Do you like quite a firm bed?
Yeah.
Do you really?
Why wouldn't I know that?
Oh, that's weird.
You're weird?
You're weird, man.
Don't let the grass grow. Don't let the wheels.
No, I think I'll get home. I'll get into bed and I'll sleep, and then I'll get up and do it all again tonight.
You want to do more?
Yeah.
That's why you do so much overtime, is it?
Yeah, I eat, sleep, breathe it.
You need to get a life.
I think being a paramedic is an important job, but it's a job that's changing. It's no longer just going out to genuine emergencies anymore, you know? You are almost a social worker, a mental health practitioner, a district nurse, a GP, a policeman. Yeah, honestly, you know, at what point do we stop? At what point do we say, no, we can't do anymore? That's out of our scope of practice.
This old girl came on the phone one night and she said, I just want to say thank you to you for coming round earlier and picking me up off the floor. You've really done me a treat. And I was gobsmacked. All it takes is one person saying thank you. Making a difference to that one person will set you up for a night full of nonsense.